Hello, my name is Kale Salsade, and I chose to do my disease on cardiovascular disease for the adult and older age group. So this was the PSA that I created for the discussion post 2 days ago. It has the symptoms and signs, risk factors, how to reduce risk factors, and consulting your doctor if one contracts CVD, and also has a quick summary and definition of cardiovascular diseases as well. What is cardiovascular disease? Cardiovascular disease is a type of disease that affects the heart or blood vessels. The risk of certain cardiovascular diseases may be increased by smoking, high blood pressure, high cholesterol, unhealthy diet, lack of exercise, and obesity. Cardiovascular disease is a general term for conditions affecting the heart or blood vessels. It's usually associated with a buildup of fatty deposits inside the arteries and an increased risk of blood clots. It can also be associated with damage to arteries and organs such as the brain, heart, kidneys, and eyes. So, symptoms. How does one know when they have contracted a form of CVD? Some common warning signs of CVD would be chest pain, chest tightness, chest pressure, and chest discomfort, also known as angina. Shortness of breath. Pain in the neck, jaw, throat, upper belly area, or back. Pain, numbness, weakness, or coldness in legs or arms or other extremities of your body where blood vessels have narrowed. Consult a medical practitioner or doctor if you experience any of these listed symptoms. Outcomes. CVD is a very high-risk disease. High blood pressure or arrhythmias to strokes can all occur if one has CVD. In serious or emergency cases, death can also be a possible outcome if left untreated. Treatments for cardiovascular disease include tangible items, but as well as lifestyle changes such as exercise, no excessive smoking and drinking. It can also lead to physical changes such as angioplasties, where surgeries where balloons and stents are used to treat narrow heart artery blockages. Other treatments include prescriptions such as blood thinning medicines, statins, beta blockers, nitrates, and diuretics. Some common risk factors play into CVD, such as obesity and overweight, excessive smoking and drinking, lack of exercise, consuming highly saturated sodium or fatty foods. It can also be genetically linked. Familial problems of heart disease, such as palpitations, high or low blood pressure, or predisposition to strokes. So let's take a look at the public health prevention strategies. For the primary, regular exercise and eating healthy, avoiding saturated or trans fats, sodium, and excessive oil and fats. Obesity can also increase your risk of contracting CVD. Avoid smoking and drinking excessively or entirely as they lead to blockages or downstream complications of your heart. Consult your doctor. Knowing if you're at risk due to being genetically predisposed can help an early diagnosis be treatable and avoidable. For secondary, screening and diagnosis. Getting yearly checkups or screening is crucial and can be used for the secondary or primary method. Such screening can include resting EKGs or electrocardiograms. They offer a snapshot of your heart rhythms and can be used to identify micropalpitations or arrhythmias or VFib. They can also measure the amount of electrical activity in your heart. Stress tests or exercise tests can be also done to measure your heart stability and stress when working out or due to high stress situations. Echoes or echocardiograms also offer a better picture of your heart. Doctors can read this and see blockages, layers of your wall, damages to the layers of your wall, and on the inner lining of your heart and how it contracts. Blood tests are also great since they can let you know how oxygen-rich your blood is, amount of red blood cells and white blood cells, and if you have a vitamin or mineral deficiency such as iron deficiency or vitamin D. Heart CT scans can also be done to view a better picture of your heart. For the tertiary level, managing CVD can be done. In some extreme cases, pacemakers or heart monitors can be used and implanted to alert and measure heart activity or problems. Taking your own blood pressure and measuring it is also very crucial. Beta blockers, aspirin, and other prescriptions as listed earlier can be used to thin or prevent blockages and prevent future strokes and heart issues. Have routine checkups with your physician. It's also important to get screening done and to track your heart's problems. Now for my reflection. In my PSA, I believe I did a great job making a visually appealing and informative PSA poster. It touches on all three levels of the public health prevention strategies and is also easy to read to the general public. It addresses important information such as the warning signs, summary of heart disease, and what next steps to take when diagnosed. And lastly, this is my works cited. Thank you.